Don't miss that!
Welcome back to Don't Miss That Radiology. I'm Dr. Matt Hartman from Pittsburgh, PA. Today's episode starts a brand new series. We're going to talk about one of the most underrated skills in radiology, anatomy. The reality is you can't recognize abnormal until you know normal. Whether you're looking at chest x-ray, CT, MRI, ultrasound, or fluoroscopy, your eyes should constantly be asking, what structure am I looking at? Where should it be? There's simply too much anatomy to cover in one single episode, so we're going to break it into several parts. In each episode, we'll focus on a handful of high-yield anatomy pearls that come up over and over again on exams, on the wards, and in my book. Don't miss that. We start out each section with anatomy. I think it's so important. So this isn't going to be an exhaustive anatomy lecture. Instead, I'm going to share practical landmarks, relationships, and memory tricks I use every day when reading studies and teaching medical students and residents. Today's pearls include the lesser sac, the two key structures that pass between the aorta and SMA, the three rivers as they relate to the portal vein, important peripancreatic anatomy on ultrasound, and we will have some clinical vignettes, try and make this clinically relevant. And this is our AI generated image for the episode, and AI does okay sometimes, but see how many errors you can spot in this image. I tried like 10 times and AI just couldn't get it right. So, but it's a better artist than I am, so let's get started. So this is straight from our book. Don't miss that. What two structures pass between the aorta and SMA? This is extremely, extremely important anatomy. It's clinically important and can be a great landmark if you don't know what you're looking at. You can always go back to this relationship. And I like this diagram showing the sagittal depiction of the aorta. The vessels off the aorta are going to be the celiac and then the SMA. So we make note of the SMA angle, the distance, and this occurs about the L1, L3 level. So this is for anyone who's watching the podcast. If you're listening while you're driving or working out, come back, look at these pictures. They're pretty good. But we remember there are two structures that go between the aorta and SMA, which can get squashed, the left renal vein and the third part of the duodenum. Here is a coronal depiction, and this shows the duodenum being compressed. So this would be our so-called SMA syndrome, which we see in younger females who lose weight quickly. Remember, there's a lot of fat in our body, which sort of acts as cushioning, and in the retroperitoneum, the peritoneum, and that's one of the things that helps give us cushioning, protection when there's a car crash or something, and also space between the different structures. And one of those things is the aorta SMA interval. And if that distance decreases when you lose weight quickly, those two things going between the aorta and SMA, the duodenum and left renal vein, can get squashed. Well, this goes back to the Hartman 6 patterns. If this distance is narrowed, our tube going across the duodenum will be also narrowed. What's going to happen to the stomach upstream? Well, it's going to dilate. A dilated stomach, narrow duodenum. How is the patient going to present? Well, they're going to be throwing up. The food can't make it through. They're going to lose more weight. So this is a sort of a self-fulfilling prophecy. They lose weight, then they keep losing more weight because the food can't make it through because it's getting squashed. So we also said that the left renal vein crosses. Well, we'll see a CT image coming up in a second, but be thinking in the back of your mind, what could the consequence of that be if the left renal vein is getting narrowed as it crosses that long distance? And where's it going to empty into? Well, we're going to have big blue here to the right of midline. So here's a nice depiction, and here's the answer, the two structures between the SMA aorta, left renal vein, and third part of the duodenum. So let's go through the anatomy here. So we have big red, the aorta. If we had a couple slices up, we would have the celiac axis. But we're at the second vessel, we're about L2, L3. This is the SMA. And we will have big blue over here. That is our IVC. So we have big red and big blue. And SMA. And then what is to the right of the SMA? Well, it's going to be one of our other questions coming up. Spoiler alert, that is going to be the SMV. And the SMV should be to the right of the SMA. What comes to join the SMV? Well, that's going to be our splenic vein, which lies right in front, right behind this retroperitoneal organ. This is the pancreas. So we got splenic vein. Again, here's our spleen. So we got the splenic vein running west-east, joining the SMV, and that's going to join up and form the portal vein. So nicely showing our aorta SMA again. There's our left renal vein, which can get squashed. Why is that important? Well, it could cause some backup in the left kidney, but you also have to remember what else drains into the left renal vein. Well, that's going to be our gonadal vein. Uh-oh, what happens if the left gonadal vein gets blocked up? Well, in the guy, you could get a varicocele, a dilated vein sort of in the pampiniform complex. Hey, that sounds like one of the Hartman 6 patterns, dilation. You're getting this, absolutely. And if you remember, what's the whole purpose of the testes descending into the scrotum and not being intra-abdominal? Well, it's so that they will have a lower temperature, but if there's more venous blood around there, that can affect fertility. So that's something that IR can sometimes do, is to embolize those varicoceles. And just remember, the varicoceles will be more common on the left because that gonadal vein has to go to the left renal vein, longer distance to the IVC, and can potentially get squashed between the aorta SMA. Now, here's a great boards, this is sort of a resonant level question. What does it mean if you have an isolated right-sided varicocele? We said so varicocele should be more common on the left, just as a longer passage route to make it there. But if you have a isolated right-sided varicocele, meaning there's a right-sided varicocele but not a left-sided varicocele, you should be worried about a tumor here in the retroperitoneum, which is blocking that passage of that right gonadal vein into the IVC. So lots of anatomy here. So let's move on to the lesser sac, another question from our book. What two organs does the lesser sac separate? Here's a great artist's depiction, and it is going to be between the stomach and the pancreas. We're going to learn that the pancreas is retroperitoneal. It's in the anterior perirenal space. The stomach is peritoneal, and that potential space between the two is the lesser sac. I really like this lateral projection. There's our pancreas, there's our stomach. Why is this important? Well, if you get pancreatitis, the fluid can accumulate several spaces. The lesser sac here between the pancreas and the stomach is one of them. And then the next place will be the anterior perirenal space on the left. We'll have this as a discrete question. Again, spoiler alert, we're going to go over the spaces of the retroperitoneum, but one of the spaces is the anterior perirenal space, which includes the pancreas, parts of the duodenum, and the ascending, descending colon. But when you get pancreatitis, again, the fluid will drain, accumulate in the lesser sac and the anterior perirenal space. Well, why is this important? What are we going to do if we get a infected collection here or a big pseudocyst? Realize this is necrotizing pancreatitis. Look, part of the pancreas has been autodigested and has been replaced by this fluid. This is a couple of days after the acute incident, so this is going to be an acute necrotic collection. So, and it could potentially get infected with, it's not infected at this point, but if they wanted to drain this, how are we going to do it? Well, doing it percutaneously is going to be tough. We'd have to go through the stomach. So the great thing is our GI friends can do a cystgastrostomy tube, meaning they put the tube between the stomach and have it go to the lesser sac so that fluid will drain into the sterile stomach, which is a lot better than putting a percutaneous tube, which could get super infected. So key anatomy here, lesser sac, and realize we'll have the foramen of Winslow, can communicate with the greater sac, but right now we are talking about the lesser sac. So I think we'll make this the last pearl for today. Hopefully you're learning a lot. And this is one of my favorite ones. What two veins combine to form the portal vein? I think I mentioned I'm from Pittsburgh, and this Jeopardy question came up a couple months ago. I turned this into a TikTok. For those who don't know, in Pittsburgh, people talk. If you watch the Pit, one of my favorite TV shows, some of the patients coming in, they'll mention are Yinzers. Those are like local Pittsburghers. They sort of have their own dialect. A Yinzer, since in the South, I trained at Emory, we say y'all. But in Pittsburgh, we say you guys, and it's been shortened to Yins guys. So that's someone from Pittsburgh, but we always think of Pittsburgh with the three rivers. And this is always a Jeopardy question, where are the three rivers? But it makes me think of the portal vein anatomy. We're gonna have our portal vein going hepatopedally towards the liver, hopefully. That's normal. But what is it made of? Well, we are gonna have the splenic vein. Hey, we just saw that with our lesser sac and our pancreatic anatomy. Yeah, good memory on that. Go back, take a look at that. So there's our pancreas there. And then it's going to drain all the mesenteric guts through the SMV. So our portal vein will be the confluence of the SMV and the splenic veins. That's why all the nutrients with the chylomicrons digesting the lipids, the carbohydrates, the proteins are going to be processed, go up through the SMV, then go to the liver where they will be further processed. So I said I'm from Pittsburgh, three rivers. So here you go, the Monongahela, the Allegheny, we live in Allegheny County. And what's the third river that they form, the so-called portal vein? Well, that's going to be the Ohio River going to our state to the west, and then will eventually drain into the Mississippi River. So key anatomy, portal vein equals the splenic vein plus the SMV. I think we'll stop here. Review this. I have TikToks on this. It's in the book, but this is key anatomy, and I hope it's making sense. And if it's not, just get out the images, copy it, draw it yourself, and I think it'll start to make sense. And when you're looking at images on your own, try to get those landmarks, find the splenic vein, find the aorta, find the SMA, and look for those two things going between the aorta and SMA, the left renal vein and the duodenum. Thanks for listening to the Don't Miss That Radiology podcast. I'm Dr. Matthew Hartman. Remember, you only see what you know. Keep learning and don't miss that.